Hello everyone, welcome to sqadia.com, and in our fourth section of the lecture topic urinary tract infections, we will talk about dysuria and urethral caruncle. In this section, we will talk about dysuria, urethral caruncle, and differential diagnosis and treatment of dysuria and urethral caruncle. So dysuria, as we mentioned before so many times, is difficulty in passing urine. What are the causes of dysuria? It can be mechanical factors and it can be factors for painful micturition. Mechanical factors, it can be prolapse with big cystocele. Prolapse is uterine prolapse is when the uterus bulge out or comes out, and then with big cystocele is also there is prolapse of the urinary bladder. So prolapse of the uterus and cystocele or prolapse of the bladder, these are the mechanical factors that can cause dysuria. Then factors for painful micturition can be present in the urinary bladder, they can be present in the urethra, or there might be some trauma of the urinary system, or they can be post-operative after the surgery. Post-operative causes of dysuria are cystitis or urethritis. It can be caused by catheterization after the surgeries. Usually the patients are catheterized, and once the catheter is removed, usually patients have very, very bad dysuria or difficulty in urination. Or it can be due to trauma around the bladder, neck, and urethra after the surgery. Then dysuria, patients who presents with dysuria usually important initial history is important, in which we ask if the dysuria is without frequency or urgency, or history suggestive of any pyelonephritis, or if there is complicating features like which are dipstick urinalysis, formal urinalysis, and culture. And if the dysuria shows any nitrites, blood, leukocyte esterase, and if there is any positive result for any urinary tract infection, if there is any high level of creatinine, if there is any blood present in the urine. So all these are important to ask patients with dysuria. And if there is any negative result for after the urinalysis, usually we wait for the culture of the urine. If the culture shows a positive result, usually the treatment is started. If the culture is negative, usually the treatment is not required. If there is usually dysuria is present with urgency or frequency, usually we treat the cystitis, or treatment of the uncomplicated cystitis is performed. If there is vulvovaginal irritation, if there is discharge or lesion, usually examination is done, smears are tested, microscopy is done, and also nucleic acid amplification test is performed. Any positive saline or potassium hydroxide perhaps usually gives the idea that the patient might have vaginitis. If there is positive nucleic acid amplification test, usually these are suggestive of sexually transmitted infection. If there are skin lesions or dermatitis is present, usually it gives the idea of the dermatitis. So history is important. Ask the patient if they have simple dysuria or if they have dysuria with urgency and frequency. And then treatment is again depends on if they have simple dysuria or if they have dysuria with urgency or frequency. If they have dysuria with urgency and frequency, then treatment for cystitis is performed, and in which case we give antibiotics for about 7 to 10 days. If there is irritation, vulvovaginal irritation, if there is lesions or if there is dermatitis or involvement of the skin, usually we perform the microscopic examination and smear are tested, and that nucleic acid amplification test is performed that separates if there is vaginitis, if there is sexually transmitted infection, or if there is dermatitis. Then urethral caruncle. If you see in this diagram, this gives it's a lesion of urethra. This is the prolapse urethral mucosa. This is urethral caruncle. So here, prolapse urethral mucosa, and this is urethral caruncle. It's a lesion of the urethra characterized by pedunculated reddish-looking mass protruding out of the external urethral meatus. This is external urethral meatus, and it's the pedunculated mass coming out of external urethral meatus. Pedunculated mass is the mass attached with the stalk to the urethra, and this is prolapse urethral mucosa. Here, this is the urethral caruncle. If you see this arrow here, caruncle coming, it's a reddish mass coming out of the external urethral meatus. Clinical features are patients are usually post-menopausal or after the menopause. Signs is usually patient comes and when the doctor examines, there is usually a small angry red-looking pea-shaped mass protruding out of the external urethral meatus. Symptoms are there is irregular bleeding from the vagina, and there are urinary complaints also, which is painful micturition, frequency. There is retention, dyspareunia is painful intercourse, dyspareunia, and there is this is all there about the presentation of the urethral caruncle. There is a reddish pea-shaped looking mass out of the meatus, urethral meatus, and since patients are post-menopausal, usually when the vaginal bleeding is present, patient comes and then there is mass protruding out of the urethral meatus, and there is also painful micturition, frequency, and dyspareunia. Treatment is excision, biopsy, its mass is removed or caruncle is removed, and it is sent for biopsy, and there is continuous bladder drainage after the biopsy for few days. So that was all about the section 4. So thank you for watching sqadia.com.